If every morning your joints crack, your body feels stiff like a robot, or you experience a dull ache whenever the weather turns cold, you may be dealing with age-related bone and joint conditions. Stay with me through this video to understand which stage you may be in and what actions you should take right now. And don't forget to click subscribe. Leave a comment saying, "I am experiencing," and share this content with your loved ones so they can recognize early joint issues as well. Knee pain is one of the earliest signs I commonly see in older adults in the United States. The discomfort often appears as a dull ache when standing up, after sitting for a long time, going downstairs, or beginning movement after a night's rest. Many patients tell me their knees feel locked in the morning and need a few minutes to loosen up. Cold or damp weather often makes the pain worse, sometimes accompanied by cracking or grinding sounds caused by thinning cartilage. The primary cause is age-related cartilage degeneration, but several other factors weaken the knee joint. Excess body weight increases pressure, old injuries create vulnerable areas, rheumatoid arthritis triggers chronic inflammation, and decades of prolonged standing or walking wear the joint down. In the U.S., many of my patients fall into the overuse category, using the joint excessively without realizing the cartilage is slowly eroding. When knee pain arises, the most important immediate step is to reduce stress on the joint for a few days. Avoid climbing stairs, limit prolonged standing, and use warm compresses in the morning to ease stiffness. After physical activity, cold compresses help reduce swelling and soothe discomfort. Mild pain relievers may be used temporarily, but only under medical supervision due to the higher risk of stomach and kidney side effects in older adults. For long-term protection, strengthening the thigh muscles is the most effective strategy because stronger muscles reduce the pressure placed on the knees. Gentle exercises such as straight leg raises, flat surface walking, and stationary cycling are ideal for older adults. Additionally, vitamin D, calcium, and omega-3 help reduce inflammation and support cartilage health. If the pain persists for more than 2 to 3 weeks, you should see a doctor to assess the degree of degeneration and receive an appropriate treatment plan early. Hip osteoarthritis is one of the most commonly misunderstood joint conditions in older adults because the early symptoms often don't start directly in the hip. Many of my elderly patients in the U.S. come in complaining of pain in the buttock, the outer thigh, or even the knee. They don't suspect the hip joint until the pain appears when rotating the body, bending down, or standing up from a chair. A sharp pain during the first few steps in the morning is a classic early sign. Some describe a soft clicking sound in the joint or a sensation of stiffness after walking long distance. The hip joint carries a significant portion of your body weight, so some wear and tear with age is expected. However, degeneration isn't caused by aging alone. A history of falls or fractures, rheumatoid arthritis, osteoporosis, or decades of heavy lifting all accelerate hip deterioration. Many older adults in the U.S. have spent years walking long distances or standing for extended periods, causing the cartilage to wear out earlier. Once the cartilage thins, the bones begin to rub against each other, leading to pain, stiffness, and limited range of motion. If you're experiencing hip pain, the first step is to reduce pressure on the joint immediately. Avoid long walks, minimize stair use, and limit extended periods of standing. Warm compresses over the hip area help relax the tissues and decrease stiffness, while cold compresses after activity can reduce swelling and pain. In some cases, I advise patients to use a cane for a few days to give the joint a break. Mild pain relievers or pain relief patches may help temporarily but should not be overused. For long-term management, strengthening the hip and thigh muscles is essential. These muscles support the joint and reduce stress on the cartilage. I often recommend exercises like sidestepping, lateral leg raises, or stationary cycling. Maintaining a healthy weight is also extremely important. Even losing 2 to 3 kilograms can significantly decrease pressure on the hip. Additionally, vitamin D, calcium, and omega-3 help support joint health. If walking becomes more difficult or the hip feels increasingly stiff at night, you should see a doctor for a tailored treatment plan. Lower back pain is one of the most common reasons older adults come to see me throughout my 30 years of practice in the United States. The discomfort usually starts as a heavy, deep aching sensation in the lower back, especially after waking up or doing simple household chores. Many patients describe a sharp, electric-like pain when bending down to pick something up or turning suddenly. As the condition progresses, the pain may radiate to the buttocks, the back of the thigh, or even the calf, making walking more difficult and movement more limited. The most common cause is spinal degeneration. As we age, the discs between the vertebrae lose moisture, become thinner, and provide less cushioning. This leads to increased friction and pain. Other causes include herniated discs, bone spurs, osteoporosis, or muscle strain from improper movement. Many older adults in the U.S. have a habit of lifting heavy items or twisting their torso abruptly during household chores, overstretching the back muscles. When the sciatic nerve becomes compressed, the pain can radiate down the leg, making movement extremely uncomfortable. When lower back pain strikes, the most important rule is to avoid sudden bending or twisting movements. Rest in a straight back position and apply cold compresses during the first 24-48 hours to reduce inflammation. Then switch to warm compresses to relax the muscles. If the pain radiates down the leg, avoid prolonged sitting, as it increases pressure on the spine. Mild pain relievers may help temporarily but should be used correctly and not for extended periods. Some of my patients experience good relief by using a lumbar support belt for a few days. For long-term improvement, you need habits that support a healthy spine. I often guide my patients through strengthening exercises for the back and core, such as bridges, knee-to-chest presses, or simple daily walking. Maintaining a healthy weight significantly reduces pressure on the spine. Pay attention to your sitting posture. Keep your back straight, feet planted firmly, and avoid sitting for more than 45 minutes at a time. Those with osteoporosis should take vitamin D and calcium regularly to prevent vertebral compression. If the pain lasts more than 2 weeks or radiates strongly down the leg, you should seek medical evaluation and imaging. Rheumatoid arthritis is very different from typical age-related joint degeneration. It is an autoimmune condition, meaning your immune system mistakenly attacks your joint tissues. Early symptoms often appear in the small joints, such as the fingers and wrists, causing morning stiffness that lasts 30 to 60 minutes or even longer. Many older adults I have treated describe their joints as warm, swollen, and painful in episodes. Sometimes only one side is affected, but most cases show symmetrical swelling, like both wrists or both hands hurting at the same time. The exact cause of rheumatoid arthritis is still unknown, but genetics, environmental factors, and immune dysregulation all play major roles. In older adults, the immune system becomes weaker and more unpredictable, making it more likely to attack healthy joint tissues by mistake. Without proper treatment, chronic inflammation gradually destroys cartilage, erodes bone, and leads to visible joint deformity. Some of my older patients in the U.S. experience fatigue, mild weight loss, and trouble sleeping because of persistent pain. When a flare-up occurs, the top priority is to reduce inflammation as quickly as possible. Applying cold packs to swollen joints helps decrease heat and pain. Adequate rest is essential. Avoid heavy lifting or strenuous movement for a few days. Over-the-counter pain relievers may offer short-term relief, but autoimmune conditions like rheumatoid arthritis often require stronger anti-inflammatory medication or immune-modulating drugs prescribed by a physician. I always remind my older patients never to increase their dosage on their own due to risks to the liver, kidneys, and stomach. For long-term management, the most important goal in rheumatoid arthritis is controlling inflammation and protecting joint structure. Patients must take their medication consistently and never stop treatment just because the pain temporarily improves. I often teach my patients gentle exercises such as joint rotations, stretching, and short walks to maintain flexibility and prevent stiffness. Supplements like omega-3 and vitamin D, along with anti-inflammatory foods such as fatty fish, olive oil, and leafy greens, can also help reduce symptoms. Maintaining a healthy weight is crucial because excess weight increases pressure on already inflamed joints. If you notice joint deformity, difficulty gripping objects, or persistent pain for weeks, you should seek medical care to adjust your treatment plan. Osteoporosis is known as a silent disease because it shows almost no symptoms in the early stages. Many older patients I meet in the U.S. tell me they felt perfectly fine until a minor fall resulted in a fracture. Some notice their height decreasing over the years or a slight forward curve in their posture, both signs that the bones are weakening. A dull backache when standing for long periods or lifting even light objects may also be related to osteoporosis. In more advanced cases, collapsed vertebrae can cause sharp pain, difficulty breathing, or fatigue during movement. The most common cause of osteoporosis is the natural decline of calcium and vitamin D as we age. When the body does not absorb enough nutrients, bone density gradually decreases, making the bones brittle and prone to fractures. Postmenopausal women are at higher risk due to falling estrogen levels, which normally help protect bone strength. Additionally, people who are sedentary, smoke, drink alcohol frequently, or have thyroid, liver, or kidney conditions are more likely to develop osteoporosis. In the U.S., many older patients I treat develop osteoporosis from long-term corticosteroid use without regular bone density monitoring. When osteoporosis is suspected, the first step is reducing fall risk. Keep your living space neat. Avoid slippery rugs and ensure good lighting in hallways and bathrooms. If you experience back pain or suspect a vertebral compression fracture, avoid bending forward or lifting heavy items. A temporary back brace may help prevent harmful movements. Calcium and vitamin D supplementation is important, but the most critical step is getting a bone density scan, DEXA scan, as soon as possible to assess your bone health accurately. For long-term management, preventing and treating osteoporosis requires a combined approach. I always advise my patients to consume calcium-rich foods such as milk, cheese, yogurt, leafy greens, and nuts. Exercise is essential. Weight-bearing activities like walking, light stair climbing, or small hand weights help stimulate bone growth. For adults over 65, I often recommend balance training to reduce fall risk. Osteoporosis medications such as bisphosphonates or bone-building treatments should be prescribed and monitored by a physician to ensure effectiveness. If you have already experienced a fracture, your treatment must be more aggressive because the risk of a second fracture doubles. Shoulder tendinitis is one of the conditions that makes daily activities difficult for many older adults. The most common symptom is pain when lifting the arm overhead, especially while reaching for items on a shelf or putting on clothes. Many of my elderly patients in the U.S. describe a sharp pain in the outer shoulder that sometimes radiates down the arm. At night, the pain often worsens, waking them up when they turn in bed. Some hear a clicking or popping sound when raising the arm, an indication that the inflamed tendon is rubbing against bone. The most common cause is chronic overuse of the shoulder, especially in people who have spent years working with their arms overhead or lifting heavy loads. As we age, the shoulder tendons lose elasticity and become more prone to inflammation or small tears. Shoulder arthritis, bone spurs, or poor posture also contribute to tendon compression. Many older adults in the U.S. previously played sports like tennis, golf, or swimming, and their tendons have gradually worn down over time. In some cases, even a single wrong twist of the shoulder can trigger acute inflammation. When the shoulder is inflamed, the most important step is to let the tendon rest. Avoid overhead movements, lifting heavy objects, or forceful shoulder rotation. Cold packs for 10-15 minutes can reduce inflammation, followed by warm compresses to relax the muscles. Gentle movements, such as pendulum swings or slow shoulder circles, help reduce stiffness without stressing the tendon. Over-the-counter pain relievers may help temporarily. In some cases, I recommend a shoulder support strap for a few days to reduce tendon irritation. For long-term prevention, strengthening and improving the flexibility of the shoulder is essential. I often teach my patients exercises that target the external rotators, internal rotators, and deltoid muscles to stabilize the joint. Light resistance bands work very well for older adults, maintaining proper posture, especially keeping the shoulders from slumping forward, helps reduce tendon compression. You should also ensure adequate vitamin D and omega-3 intake to reduce inflammation. If the pain lasts more than 2 weeks, or you cannot lift your arm above shoulder level, you should see a doctor as the tendon may be partially torn. Spinal stenosis occurs when the spinal canal becomes narrowed and compresses the nerves, causing pain and weakness in older adults. Many of my patients in the U.S. report dull lower back pain radiating to the buttocks and the back of the thighs. A key sign is that the pain worsens the longer they walk, but improves noticeably when they sit or bend forward. Some describe tingling or pins and needles sensations in the calves or feet, similar to a mild electric shock. In more advanced stages, the legs may feel weak, unsteady, or give way unexpectedly. The most common cause is age-related spinal degeneration. As the discs lose moisture and collapse, the body compensates by forming bone spurs to stabilize the spine, but these spurs narrow the spinal canal. Ligaments also become thicker with age, contributing further to the narrowing. Patients with a history of back injuries or long-standing herniated discs are also prone to stenosis. Heavy labor, years of lifting, or chronic arthritis increases the risk as well. During a flare-up, the goal is to relieve pressure on the nerves. Avoid long walks and take frequent breaks. Slightly bending forward while walking can help reduce pain, as this position temporarily widens the spinal canal. Warm compresses on the lower back relax the muscles, and mild pain relievers or anti-inflammatory medication may be used short-term. I often recommend a walker or cane to reduce strain and prevent falls in older adults. For long-term management, strengthening the back, core, and gluteal muscles is essential because they support the spine. I often teach patients gentle exercises such as pelvic tilts, slow leg lifts, or short but regular walks. Maintaining a healthy body weight significantly reduces pressure on the lumbar spine. Physical therapy can also help improve posture, increase mobility, and reduce pain. In more severe cases, when leg weakness worsens or pain persists for months, patients should consult a specialist to evaluate steroid injections or decompression surgery. Knee effusion occurs when excess fluid accumulates inside the joint, causing swelling, tightness, and difficulty moving. Many of my older patients in the U.S. describe a heavy feeling in the knee, as if carrying a small water pouch in front of it. When touched, the joint may feel soft and slightly warm. Another clear sign is a ballooning effect. Pressing lightly on one side of the knee causes the opposite side to bulge due to the movement of fluid. Pain usually worsens when climbing stairs, squatting, or standing up after sitting for a long time. Knee effusion has several causes, but the most common in older adults are osteoarthritis and inflammation. When cartilage wears down, the joint becomes irritated and produces excess fluid. Minor injuries such as missteps, twisting the knee, or falling can also trigger swelling. Some of my patients in the U.S. experience effusion due to gout or rheumatoid arthritis, both of which cause significant inflammation of the synovial membrane. Excess body weight is another major risk factor, because increased pressure on the knee makes the joint more susceptible to injury. To reduce swelling quickly, you can apply the RICE method: rest, ice, compression, and elevation. When the pain is severe, limit walking and avoid stairs or squatting. Cold compresses for 10-15 minutes help reduce swelling significantly. If the knee feels overly tight, a doctor may perform fluid aspiration to relieve pressure and identify the cause. Mild anti-inflammatory medications can be used short-term, but they should not be overused, especially in older adults with stomach or heart conditions. For long-term management, the key is addressing the underlying cause of the effusion. If osteoarthritis is the trigger, maintain gentle exercises such as knee extensions, flat surface walking, or stationary cycling to improve joint lubrication. If gout or rheumatoid arthritis is involved, follow your doctor's treatment plan and follow dietary restrictions carefully. Losing even 2 to 5 kilograms can significantly reduce knee pressure. Avoid high-stress activities such as deep squatting, jumping, or long-distance running. Regular follow-ups help detect recurrent effusions early and ensure timely treatment. Bone spurs on the spine occur when extra bone grows around the edges of the vertebrae, most commonly due to long-term degeneration in older adults. Many of my patients in the U.S. describe sharp or stabbing pain when standing for long periods, walking long distances, or twisting their torso. Some experience pain radiating from the lower back to the hips, buttocks, or the back of the thigh, similar to sciatic nerve pain. When the spur presses on soft tissue or nerves, patients may feel tingling or numbness in the legs. If the spur forms in the neck, it may cause headaches, shoulder pain, or numbness in the hands. The primary cause of spinal bone spurs is degeneration. When cartilage wears down, the body tries to stabilize the spine by creating extra bone, but this new bone ends up compressing surrounding structures. People with a history of heavy labor, frequent lifting, or spinal injuries are at higher risk. Poor posture, repetitive bending, and excess body weight also accelerate the degenerative process. Some older adults in the U.S. develop bone spurs due to long-standing arthritis, which causes chronic inflammation and compensatory bone growth. In the acute phase, the priority is to reduce inflammation and avoid movements that worsen nerve compression. Rest is important, and you should avoid bending or twisting your back forcefully. Warm compresses help relax the muscles, while mild pain relievers or anti-inflammatory medications can be used short-term. For patients with radiating leg pain, I recommend adjusting sleeping positions to reduce nerve pressure. Physical therapy during this stage helps improve flexibility and reduce muscle stiffness. For long-term management, maintaining a flexible spine and strong back muscles is essential. Gentle planks, lumbar stretches, hamstring stretches, and regular walking all help reduce spinal stress and slow degeneration. I also emphasize posture correction, especially for those who sit for long hours in front of a computer or television. Losing weight, if needed, significantly reduces pressure on the lumbar spine. In cases where large bone spurs compress the nerves severely and cause persistent numbness or weakness, patients should see a specialist to consider steroid injections or decompression surgery. Nutrition is the foundation for maintaining strong bones and healthy joints, especially as we age. Many of my older patients in the U.S. see significant improvement in their joint health simply by adjusting their daily diet. Calcium is the most essential mineral and can be found in milk, cheese, yogurt, leafy greens, and nuts. Vitamin D helps the body absorb calcium more effectively and can be obtained from morning sunlight or foods like salmon, eggs, and mushrooms. Omega-3 fatty acids play an important role in reducing inflammation, particularly for those with chronic joint conditions. Regular physical activity is the best way to keep joints flexible and prevent degeneration. I always encourage my patients to practice gentle but consistent exercises, such as 20-30 minutes of walking, light yoga, stationary cycling, or resistance band training. These activities not only strengthen the muscles, but also improve joint lubrication, allowing for smoother movement. The key is to exercise correctly and avoid any high-impact or overly strenuous activities that put excessive pressure on the knees, shoulders, or lower back. Beyond diet and exercise, lifestyle plays a major role in joint and bone health for older adults. Smoking and alcohol should be minimized because they reduce bone density and increase inflammation. Getting 7 to 8 hours of sleep per night helps the body repair tissues and reduce pain. Maintaining a healthy weight is crucial, especially for individuals with knee or spine pain, as every extra kilogram adds significant pressure to the joints. I also encourage patients to practice stress management techniques such as meditation, deep breathing, or light reading to keep the body relaxed. Healthy joints do not depend on medication alone. It is the result of proper nutrition, appropriate exercise, and a sustainable lifestyle. I always remind my older patients that you can improve your health at any age. With consistent exercise, balanced eating, and regular checkups, you can reduce pain, increase mobility, and enjoy a more fulfilling life. If pain lasts more than 2 weeks, or a joint becomes unusually swollen or warm, you should see a doctor for proper evaluation. Caring for your joints not only helps you stay healthy, but also keeps you confident and independent for years to come.